Well, hello, hello, hello. My name is Quinn Conyers, and I am super excited. You want to know why? Because it is open enrollment for people who live, work, play, want to start a business, or who currently in business in the state of Maryland. And if you're anything like me, I have been a full-time entrepreneur for the past not one, not two, not three, but for 6 years. And literally, the way I've been able to protect the health of myself and my family is literally the conversation that we're going to have today. But don't take my word for it. I can rant and rave about how awesome and amazing, but our special guest, I promise you, is going to give you the details, going to give you the insights on how you can make sure that literally you and your family are protected health-wise, dental-wise for 2022. And it's really important because when January 15th comes, that is when open enrollment ends. But there's good news. It's only the 5th. So that means you have 10 days to get it together. But again, I'm super excited about who we have that is joining us today. So I am not going to have her waiting too much longer because she's awesome and amazing. And you don't want your guests waiting in limbo. So I'm going to go ahead and bring on camera our very special guest. Her name is Michelle Eberly, and she is literally the executive director of the Maryland Health Benefit Exchange. Michelle, welcome, welcome, welcome. We are live on Facebook, LinkedIn, and YouTube. How are you feeling today?
I am feeling great, Quinn, and it is so much fun and so exciting to be here. I love your energy. Thanks for having me.
Oh, the pleasure is all mine. And Happy New Year to everybody as well. I know that this is January the 5th, and we got exciting news on how you, again, can protect your health of yourself and your family, especially if you live in the state of Maryland. And we're going to spend some time today really talking about your health and your goals for the year and how you can focus on growing your business and find ways to become independent and still have access to quality, affordable healthcare. And that is where Michelle comes in because she has all the knowledge, all the information really about this. So for those of you who are not familiar with Michelle, again, she is the executive director of the Maryland Health Benefit Exchange. And she is literally here to share her expertise and knowledge about Maryland's health insurance marketplace, also known as the Maryland Health Connection. Now, if you are familiar with the Maryland Health Connection, I just want you to put MHC in the comments if you are familiar with the Maryland Health Connection. So in addition to being the executive director of the Maryland Health Connection, she is passionate, she is ethically driven business and community leader, and she literally leads agencies, departments, initiatives in the insurance, healthcare, nonprofit, and government sectors. She is an active community volunteer and a former elected official. She thrives in environments faced with challenges and obstacles, and literally give her a strategic need and she'll tackle it with tenacity. She'll resolve it with finesse, and she'll inspire a team that exceeds expectations. So I am not going to make her wait. Michelle, I'm so excited to have this conversation with you. So let's go ahead and get the party started because I know that so many people literally have questions about the Maryland Health Connection. So I want to go ahead and jump right in. So as an entrepreneur, as a small business owner, what does health coverage mean to you? And why is this Maryland Health Connection so near and dear to your heart?
Well, it's near and dear to my heart because health is near and dear to my heart. And we all want to live our best lives. And living our best lives, we can't do that unless we're healthy. So having health insurance coverage where you can get wellness care, preventive care, and really support you if you get sick is just critical. And not only for you as an entrepreneur, as a business owner, as an employee as well, but also for your family. If your family's not well and healthy and doing good and thriving, you're not going to be able to thrive. So we're here to make sure that we can get everyone health and coverage and wherever they live in the state and whatever they do, whether they're employed or stay at home, we want people to have health coverage.
Yeah, absolutely. And now more than ever, I think our health has always been important, but because of the current state of society, health and is really important. So, I want to talk about that in just a second, but there's a couple of key dates that are around the corner that I really, really want, to make people aware of so we're not missing the awesome opportunity. What is that key date that people should be really signing up for their health plan by?
January 15th. So for coverage that will start February 1st, We want you to come in and get enrolled, and you have until January 15th to do that. We have multiple ways that we can get you enrolled. Go to our website, marylandhealthconnection.gov, download our mobile app, enroll MHC, call our call center, and I'll give that number now and then later as well, 855-642-8572.
Let's that number one more time, Michelle. I'm going to put it at the bottom of the screen. Go ahead.
It's 855-642-8572. And not only can we help you over the phone, but we've got folks across the state that can help you either this way through video, setting up an appointment. So we've got lots of people that can help find the right coverage for you and your family. And we want you to get in and get enrolled. This is the best year to do so because our rates are very, very low this year. Best rates we've had ever. So come on in and we're here to help you. January 15th.
Yep, and I'm going to put that at the bottom for all of you so you can see right now, whereas you can call again 855-642-8572. Whoops, let me go ahead and edit that real quick. I saw something that I did. Give me 1 second. I was making sure I was trying to be in real time so you can get that information as well. So let me go ahead and update that. So also too, Michelle, you know, what does it mean to enroll, right? Because some people might be brand new and maybe they work with their job or their employer and they like sat down with HR and filled out a couple of boxes. So can you kind of explain what does that process? People can go online or they can call a number, but what can they expect when they call? What can they expect when they go online? How does somebody enroll in health coverage?
Really good question. And we asked several questions. Now, since we have the Affordable Care Act, one thing to remember is that you cannot be denied health coverage because of a medical condition. So everyone can get covered. There's a few stipulations on that, but most everyone in the state of Maryland can get health coverage. When you come to look at the plans we have available, and we say we're the one place you can come in, you can look at our plans, you can enroll in a plan, you can price shop. We want you to have some information available with you when you start to sit down and do your application. So we're going to need to know what your family size is, the makeup of your family, age information, income information, and if there's any other household coverage. And then also if you are in the country with some permanent residency documentation or other documentation that verifies your status, we may need that as well. And I wouldn't even worry so much about that. Just come take a look and we can help work you through that process. But typically what we do is we ask those questions. Where do you live? What's your income? We need to know your income because you may qualify for free health insurance based on your income. You may qualify for premium tax credits that are paid in advance, lowering your premiums. This year we have something new. It's called a young adult subsidy. And it's for anyone between the ages of 19 and 34. And if you come in and enroll in health coverage, you can get an additional tax credit for that. So for instance, we have, if I look at somebody in, let's just say Baltimore City, and with all of those premium assistance, we can find health plans as low as $9 a month for an individual, which is really affordable for comprehensive health insurance that will cover not only going to the doctor, going to, if you are seeking mental health treatments, if you are seeking substance abuse treatments, if you want mammogram, if you want wellness care, all of that is included in our plans. So very affordable. Those are the things that you'll need to kind of come look at, have some information available, but we're here to help get you enrolled.
Michelle, I don't even know if you know what you just did when you talked about that tax credit for young adults between the ages of 19 and 34. You just liberated a whole bunch of people whose parents told them that they should stay in their job for the health insurance, right? Because that's what's been passed around. Like, I want to do this. I'm nervous to do this, or I want to try something different, but I don't want there to be a gap you know what I mean, in my health insurance. So I just believe that you just liberated a bunch of 30-year-olds. Like, you know what? I am going to go out, pursue my passion, and then sign up for health coverage on my own, right? Which literally was not a thing. Like, I remember telling my mom after I left to pursue, being a speaker and an MC and a host like I'm doing now. And she thought I was absolutely bananas. She's like, what are you gonna do for health insurance? And I'm like, there's places you can get. But I don't know if this is your leadership, but I can definitely say this time around, the wait times on the phone have been less. I was like, this is amazing. I just remember going through this last year and I'm like, oh my God. Because I always have questions. I'm a question person. Even though I'm really good online, I just want to ask a couple of questions just to make sure that me and my two sons are great. So I don't know. I'm going to give you the credit, Michelle, because I just think that you're marvelous.
Well, thanks.
That you had something to do with the wait time, because I know that was also very frustrating in the past. And I just wanted to comment and say, I did mine in preparation for this so I can talk about the experience. Like, okay, you know what? I just updated my re-enrolled, and the wait time was pleasantly short. I was like prepared, like, all right, got my water, I got ready. I'm just going to wait until they're ready, but it was great. So thank you for that. We do have a comment from LinkedIn. Hyatt says, good to know. Thank you so much, Michelle. So people are already learning from you, and education is the best thing ever. So she's liking what you're saying right now. So I want to go ahead and keep it going, right? When it comes down to, picking, plans, right? So this is not just for health. Is it dental as well included when people can pick out their health plans?
Our plans through private commercial insurance do not include dental plans. However, we have what we refer to as standalone dental plans that are available for purchase. And just like looking for a medical plan, you can come online, you can look and see what we have, you can see what the costs would be. So we have multiple carriers for dental plans. Some of our Medicaid plans do offer dental coverage. All of our plans have some dental coverage for young folks, for children. So that there's some of that included as well. But the important thing to note, and this oftentimes people don't get when they're an employer, go get their employer's coverage, is that the employer may offer medical insurance, but not dental insurance. So even if you are getting your medical insurance elsewhere, say you do have an employer that's giving you medical insurance, you can come to the exchange and get dental insurance, just the dental insurance. So that's something we want to really make people aware of. But you're right. If you're 30 and you want to start your own business and you're like, where am I going to get that health coverage, which is so important? Now you have a place to go get it. And it's very affordable. And the nice thing is that it stays with you. So if you're with an employer and you leave your employer, you leave that health coverage behind and you're reliant on a new employer and their health coverage. But if you purchase it for yourself and you do something different, you always have that coverage. It stays with you. So that's a really good thing when you talk about most plans have deductibles, meaning out-of-pocket costs, and you don't want those to reset all the time if you're going with a new employer. So really pursue those dreams and come to Maryland Health Connection and get coverage. We've got it for you. It's affordable.
No, it absolutely is. And I love it. I have a couple more questions, but listen, Hyatt has a question. Hopefully I'm saying your name correctly. And she brings up a really, really good point, which I want to ask you as well. Mental health is new, not new, but it's new that people are addressing it. And there are opportunities to get and see someone. With these plans, are mental health services available through some of these health plans?
All of our plans have mental health services, and not only mental health services, but substance use disorder services as well. So oftentimes they'll go hand in hand, and we're looking for help in both areas. We've got you covered. So that all of our plans have providers that would cover those services.
That is awesome, Michelle. I love that, because I feel like a lot of times, it's getting better, but that was a nice to have. It wasn't a necessity, but burnout is real. Battling maybe a family member who didn't make it through COVID and you have to go and perform as normal. Like, you might need someone to grieve and someone to talk to. So I love that all of the plans do include that. And before, I don't know, it's just a great time to get covered health-wise, because there's so many things that was a bonus or an add-on that's just included, right? Would you agree?
I would. And it used to be, 20 years ago, health insurance was really meant to keep you out of bankruptcy. And it was, if you're going to have a medical condition, you don't want to enter into bankruptcy. With the Affordable Care Act, what's happened is we've kind of moved from that catastrophic protect myself from bankruptcy, which it also does, but into more health care. So providing health care, and that's through the wellness benefits. That's through making sure you can get your immunizations at no cost yearly. You can get a physical for your children for school, no cost out of your pocket for that. Your prevention screening. So now it's moved a step further to say, we really want to invest in people to keep them healthy. And these are the things that will keep them healthy. So it's a great time for health insurance in America to get really affordable, good coverage.
No, you're absolutely correct. And, for people who might be new to this, they might be wondering, well, what type of health insurance companies, are providing these plans? And I know that Care First is one. Is there other recognizable people that like, these are not just, makeshift insurance companies that were born last night. Like these are reputable companies. So can you talk about some of the insurance companies that are available?
Absolutely. We have, of course, Care First, as you mentioned, United Healthcare, and Kaiser Permanente. There are three largest in the private marketplace. And then also in our Medicaid, there's additional providers. We have Aetna's in there, and Physicians Care, and there's a few others that I can't recall at this moment. But for the private commercial insurance, which most folks would probably be coming in to get, those are the three: Care First, United, and Kaiser.
I think that's important because a lot of times you might be a little bit nervous if you have been in a job for 10, 20 years and you have been used to those companies. They still exist on the other side. It's not like, they go away. So there could be some ones that you recognize and some other ones that have just great care as well that you might not know. And I really wanted to do that because I know the trust can be like, well, I'm so used the idea and the notion of getting coverage outside of where I work is sometimes new to people. And if you are, living, working, playing in Maryland and, your health information has come from your parents, this didn't exist. It was like you worked for a job and that is how you got health coverage. I literally know people, Michelle, who are waiting to turn 65 to start businesses and leave companies so they can get everything that was promised to them. So, I just wanted to say that these are real deal companies. Some of you already know that. Most of my friends who are full-time entrepreneurs were all, with the exchange. But for people who, you might have just started in 2022 fresh, being independent and needing coverage. So I just wanted to kind of mention some of those companies that are widely recognizable.
And one other thing I want to mention, because this is something different that came out this year with the American Rescue Plan. It used to be that if you made a certain dollar amount, you weren't eligible for any tax credits. And we called that the cliff. So anyone that would start to inch up in their income level may not be eligible for tax credits. With the American Rescue Plan, that changed. So for this year and for next year, and we're hoping that the federal legislation will become permanent, but at least for this year and next year, they've removed that. So now it looks at it just as a percentage of your income. So people that before maybe thought, well, I make too much money, I'm not going to be able to get any help paying for this. Don't think that way. Come on in and check it out because things have changed.
She's absolutely right. And, this is one of the reasons why I wanted, before we had this interview, I wanted to enroll personally, because I had, look, hand clap to myself. I definitely made some more money in my business this year. I'm like, there's no way they're going to raise it up. And it still was around the same. And I made significantly more. So she is right when she says that don't be like, oh my gosh, I make too much. They're not going to accept me. It really is, working with all different. So I hope, like you said, they keep that going as well, because again, my husband, he works, at a job, but if he were to add 4 of us, his insurance would be like an extra kidney, So we decided to put the kids under, me. And that's just kind of good to know as well. So yeah, I was a little nervous as I was filling it out. I'm like, oh my gosh, what is this about to jump to? And it was it still made sense because, I didn't know it was going to go. So let's talk about some of the things that health benefits cover. Like, I know we talked about mental health services. I know it's doctor visits, prescriptions. What are some of the other things that, having a health, insurance could cover that we really need to be mindful for?
Mm-hmm. Well, I'm going to talk a little bit about our value plans, because everything covers essential, what we refer to as essential health benefits. So it's going to the doctor, getting physical therapy, mental health, we talked about, pregnancy, coverage. Those are basic coverage services. But one thing I want to mention is that we developed what we call value plans a few years ago. And the intent behind them was that we heard loud and clear from folks that, gee, our deductible's too high. We're afraid we can't use any services because we have to meet that deductible. So we came up with plans that have a limit on that deductible. There still may be some co-pays and some out-of-pocket costs, but it really keeps that cost low for what a person has to pay for. Then, in addition to this, I want to make this point, we looked at what are some of the prevalent conditions in Maryland that are affecting Marylanders. One being, say, diabetes, very big condition that affects many people. So we looked at how can we provide plans that folks need to be able to afford their insulin, their glucometers, their test strips. If they can't afford those materials, they can't control their diabetes if they're not able to buy their insulin and such. So we've built that into some of our plans where you can see some of the costs for those medicines are much lower. In fact, many of the carriers do that across all plans. So when you're looking at your coverage, it's also important to look, if you do have a chronic condition, look at some of the plans and see what they offer. Plans are a little bit different, but it's another thing to keep in mind, to look at what condition you might have and see what is offered for treatment for that condition and at what cost.
No, that's good to know as well. No, really, really good information. And I know that some of you are catching this live. Some of you will be catching the replay, which is good. You still have 10 days. January 15th is that day that you can select your plan. And remind everybody, if people sign up by January the 15th, when does that plan actually kick in? When does it start?
February 1st.
Okay, perfect. I just want to make sure that people know that with, everything that's going on. Now, you mentioned it earlier, but I think it's worth mentioning again, right? For people, it's their first time. Is there assistance with enrolling? Is there someone they can call, which I have the number at the bottom?
Yes.
Is it just like figure it out on your own? Talk about some of the assistance, because this is very new to people. Again, I remember working, 6 years ago. You went into HR and that's what you did, right? But it's not the same. So you can call, or you can even do an email. Who can help and how can they help you with that?
Well, I love to tell people, and of course, especially if you are, mobile friendly, that download our application. And the reason I say that, and it's Enroll MHC, is that you open up the application and there's just one button you push and it's Get Help. And it has a GPS locator in it. So it will show you the help that's closest to where you physically are. So if you are in your home and you want to find out who's the closest assistance right by me that I can get assistance from, it might be a licensed producer, which I haven't talked about yet. We have authorized producers. This is their business. This is what they do. They help people get insurance. You can go see them, no cost at all. They get paid by the insurance carrier, so there's no cost to you. But you could go see a producer. You could go see one of our navigators. And those are folks that we have 125 of them throughout the state. And they, again, will do a video chat with you, or you could set up an appointment. We have folks available, or I should rather say we have bilingual Spanish speaking available in person. But we also, through our call center, have access to over 200 languages. So that's important to note, because if English is not the primary language, and if you're trying to navigate the insurance system, which is really difficult to navigate anyhow, and then you have a language barrier on top of it, it's exceptionally hard. So calling our call center, which you have the number there, again, we can get you the language help you need. We can get you in-person assistance. We can help you online. So there's just many, many ways. And the best thing is download that app, hit the click, get help, or call our call center and ask for assistance. We're happy to help.
And that mobile app, is that enroll MHC on your mobile app? Is that correct?
That is correct.
Okay, perfect. So you don't have to figure it out. I'll put it right there on the screen. We got two ways you can go to enroll MHC on your mobile app, or you can call 855-642-8572 and then pick your health plan. So listen, and here's what you said that I love. I mean, you must have been reading my mind, Michelle, because I was thinking about this. Like, we are a diversity melting pot in Maryland. There's some people, who identify as all different types of races and nationalities. So the fact that you said there's bilingual, and then if you call, there's over 200 different languages that people can really assist you. Like, that is amazing. Was that intentional? Because I mean, you said 200. I'm thinking besides Spanish, Russian, German, like where else is there? Right. But why was that such a priority? Just to make sure that people who English was not their first language still felt comfortable and confident to call or to enroll in getting the proper health coverage for themselves and their family.
Well, like you said, we are a melting pot, and we need to celebrate everyone's heritage and individuality, and we want to make it easy for everyone to get coverage. So even on our website, I didn't mention this, but on our website, you can also translate the website into multiple languages. And so that's another way we can help. But again, our mission is to make sure everybody in this state has some form of health coverage. And whatever we can do to make that easier for people, to make it more attainable, more accessible and attainable, that's what we want to do. So that's what's led to really working with our community partners, trying to be as inclusive in everything we can, and how we deliver our services, how we develop our products, really looking at what can we do to be all inclusive and really help people get enrolled.
That is so awesome. And that's another thing that I just learned. I mean, you can translate the website. I mean, it doesn't get any better than that. So not only can you call and have access to 200 different languages, but if you are on a website, you can translate it into the language of your choice. I mean, that's not inclusivity of making sure that Maryland is protected with their health. I mean, like, just kudos to you for being a leader, in this particular thing, because I think a lot of times, you want people to be covered, but it's not easy, right? It's like certain things like, why are all these barriers, right? So now people are getting frustrated, they're not doing anything, and now they're underinsured. So, all that good stuff. So Veronica Cool is in the comments, and she says, so grateful that we have Spanish access for our Latino community. Can you address what immigration statuses qualify for coverage? That is a message we have from the audience.
Yes, Veronica is giving me a good challenge here. Yes, so anyone who is here with authorization, it could be a green card to work. There's a whole criteria of what is a status that is acceptable. So refugees are acceptable. Again, if you have a work permit, and I'm afraid I can't list them all right now, but we can certainly get that information where you can connect it on your sites. But there's, I think, many categories.
Yep. No, that's good. And again, marylandhealthconnection.gov, or call that number, and then you can kind of see, what is available to you. So great question, Veronica. Thank you so much, Michelle, for answering that. And these are trained experts. I think you said 125 people across the state will be available to assist. Is that correct?
Those are our navigators. We actually have in total about 200,000 when you include in our brokers and our local health departments. And there's a lot of folks across the state, our navigators, that are available to help.
Okay, awesome. And I know that we talked about just health coverage, period, but there are some options for small businesses too, as well. So this the individual person who needs coverage, but, talk about, a small business who needs insurance, or a nonprofit organization to provide health insurance coverage to their employees. Can they also sign up and see if they're available or have options for coverage?
They sure can. Now, one thing that's very important to remember for small businesses is that to be a small business, you have to have two between 2 and 50 is your employee base.
Okay.
And what I mean by that too, that you have to have one employee that is not related. It's hired as an employee and it's not your spouse. And there's some relationship criteria around that. So we really want to make sure that you have one hired employee. Then there's several tracks you can go. If you're a small business, you can either get a traditional small business health plan, and you can come through the exchange and get that. There are tax credits that may be available, and we can help you with that as a business. So that's one avenue. That's the traditional. I'm picking a health plan and I'm going to put my employees in that health plan. The second option is that you may, as an employer, say, well, I really don't want to offer a small health plan, but I want to direct my employees to Maryland Health Connection where they can get insurance on their own. And so we could help get them through the individual marketplace that we've been talking about. A third option is that there are tools such as, or products such as things called individual coverage health reimbursement account. And that is something that provides additional support for small businesses, that they could provide some funding for their employees to get coverage. So there's those three mechanisms that we have. And again, happy to talk with any small business and get more information. If you go to marylandhealthconnection.gov, we do have a site there for small businesses, and we can certainly provide more information.
That is awesome. And I'm going to give a shout out to, I'm going to call her Marvelous Maggie Church in the comments. She has literally a fact sheet. Veronica, I know that you already saw that, to literally see the immigration families eligibility. So if you want to know what that looks like, Maggie Church, I'm going to give Maggie, she gets a hand clap. Because she was on it. She had your front, she had your back.
Thank you, Maggie.
Maggie, I'm sure you know her.
Yes. She's one of our wonderful, dedicated team. And of course, and I should have mentioned this a lot earlier, that it really is an entire team that makes all this work. And we're so appreciative of my staff and of all of the community that helps us make it all work.
Yeah, this is so awesome. And like I said, I know we are live on Facebook, YouTube, and LinkedIn. I'm also going to share this on my podcast as well, because I get a lot of replays as well, because I just know how important it is just to make sure that your family is healthy, all the way around. So yes, Veronica's like, cool facts, so many statuses. Do they qualify? Yes, she's just excited that there are so many options that exist. So for those people who are maybe, let's just say, underinsured or not insured at all, and they're scared, they're just nervous. Like you said, they might have diabetes. They're afraid if they go to the doctors or if they sign up that their coverage is going to be $1 million a month, so they just kind of sit and they deal with their ailments. They deal with not getting the medical or mental, attention that they need. Why would you encourage them is now a time to maybe get insured? And maybe they haven't been for the last maybe 5 or 10 years. Why is now a good time to kind of like get your health and make it a priority this year?
I think the first thing is to dispel the myth that, one, I can't afford health insurance because it costs too much. Or two, even if I get health insurance, I can't get any health care because it's going to cost me too much. So if we go back and we look at what, the premiums this year are the lowest they've ever been. And there's been many things the state has done to make that happen. Programs, reinsurance program, really getting more people covered, helping to reduce the cost of care. So there's a lot of things we've been doing to lower those premiums. But especially this year with what has come out of the federal government with those enhanced tax credits that I mentioned. And then on top of that, the new young adult subsidy, which is a state program, that there are a lot of plans for under $10 a month that are very comprehensive. And again, it's not just coverage for if you have a catastrophic injury. This is wellness care, preventive care. This is things to keep you healthy. So dispel that. I want to dispel the myth that it's too expensive to get, or once I get it, I can't afford to get anything covered, because we want you to come back and really understand that it is affordable and there's a lot of things that are covered without ever having to lay out a penny other than your premium payment.
Good stuff. Good stuff. I
Mhm.
mean, time flies when you're having a conversation. We're already 30 minutes in, and I like to keep things to about 30 to 35 minutes.
Mhm.
And we have it here. I mean, so again, what's the deadline for people to enroll in coverage, and when does that coverage actually begin for that person?
January 15th. So get in and get enrolled. That coverage will start February 1st. And again, get that peace of mind. We're having a big issue right now with COVID and all these variants. You can get your shots, you go to your doctor for your shots, get your tests. That's really important. We want you to get all that vaccination coverage. But in addition to that, we want you to have health care so that if you do get sick, you have coverage and you have that peace of mind of having that health care you can have.
Peace of mind in
Mhm.
2022 should be at the top of all of our lists. So Michelle, hang out for just a second. I am going to close us out and be right back with you, okay?
Thank you so much.
No problem at all. Listen, y'all, I don't know about you, but if you have not gotten the mandate, Michelle has just given us so much time and wisdom and insight on why you, especially living in the state of Maryland, can apply for coverage. Like she mentioned, if you go to your mobile app and go to Enroll MHC on your mobile app, you can do it there, or you can call 855-642-8572 and pick your health plan by January the 15th. Again, my name is Quinn Conyers. You just heard from Michelle Eberly, and she is literally over the executive director of the Maryland Health Exchange. And we just talked about literally how you really can get covered as a Maryland person, no matter if you're between certain age. There's affordable plans for everybody. Some companies that you are very familiar with, and some ones that you might be new to. But either way, call, download the mobile app, and make sure that you and your loved ones are covered for 2022 and beyond. So again, thank you so much for joining for this exclusive interview. If you know anything about me, I am a cheerleader and champion for Marylanders, especially those who are entrepreneurs and business owners. So I do hope this information was beneficial as you continue to go and pursue your entrepreneurial endeavors. Make sure that you and your family's health is also a priority. And you can do that by literally picking out your own health plan. So I will talk to you soon. Again, my name is Quinn. It's been my honor and pleasure to have this conversation with you.